Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida here in Fort Myers, Florida. We're actually at the Hauser Neck Center, and unfortunately, one of my favorite patients I've ever treated and met, Emily. This is, well, actually today's your last day, right?
Yeah, that's so sad.
And then how long have you been here?
3 months.
Okay, and then I thought it would be good to have us talk, one last time, because you traveled a long way to get here, and then why did you end up coming here? And why don't you just tell people some of your history, where you're from, and then why you and many of the family members, so I met most of your family members, they came to the United States.
Yeah, so I came from Israel, and I have Ehlers-Danlos Syndrome, which affected all of my ribs. I had dislocated ribs, all of my back ribs, my chest, my left shoulder, my both hips. I had a really large instability in my neck. My C1 was rotated. I have knees instabilities and wrist instability. And I had no doctor in Israel that ever heard about ribs dislocating, and I used to suffer so much until one point I looked for treatment on the YouTube, and then I saw your videos. And I started reading about prolotherapy, about your clinic. I had like few other patients talking, and then we started emailing. And after 2 months, I think, I was already here for having the treatments to get a better life and stop dislocating.
Now let's be honest, like getting prolotherapy, it is a painful procedure. Like every time that you got treated, it was lots of injections, lots of injections, and then we had to use a little bit of a sedative, right, to get you through it. So now having gone through it, like how would you describe prolotherapy, and then what has been your response to prolotherapy?
I honestly wouldn't mind to go through this again, because I know how it's really worked for me, and that really saved me, and I stopped dislocating my shoulder, my ribs, my hips. Oh, I forgot to say my hips before. Okay, never mind. And it is painful, but it's definitely worth it. And I already used to suffer so much when I was home, so I wasn't scared about suffering another more, half an hour, 2 hours of injection, and then few days of rehabilitation at home. That was totally worth it.
Well, let's just talk about this. So, obviously, because, you'll say to us, the audience, that you were suffering, but it was a lot of suffering.
Yeah,
so can you just give me an idea of prior to coming here, what was life like, and even what was sleep like? So what would happen every day with you?
Okay, I used to dislocate my ribs every time I went to sleep. I used to wake up every 10 to 30 minutes to doing clicks again to put them back in their place. I wasn't sleeping for a year, even 2 years for total night. And it was dislocating in a prolonged sitting. I couldn't drive, I couldn't walk for a long time. I couldn't even study because then so much pain in my neck and my headaches, dizziness, everything for my neck instability. And even though no one in Israel ever told me about the neck instability, it was first diagnosed when I was here, and you saw everything. I didn't even know about it. I was so concentrated only about my ribs that I wasn't even mentioned I have something wrong with my neck too, and that all the other symptoms is because of my neck. And I used to suffer so much. I had level pain that I could just lie in my bed and just breathe. I couldn't even talk, I couldn't move till the pain was gone. And I just wanted to do everything for getting better. And I knew that prolotherapy would be probably my last chance for having my life back.
So now it's been 3 months, so how are you feeling now?
I feel good. I feel really good. I haven't felt that way for years. I can lift my, when we show that, I can lift my shoulder and everything.
Okay, because it used to dislocate.
Yeah, I used to dislocate every time there was a burn. Now I can do it. I'm not dislocating my hips, my ribs. I can sleep a full night, 7, 8 hours without having any pains. and I don't have dizziness, headaches anymore. I don't have like the numbing as I used to have. I don't have the light sensitivity as I had. Like most of the symptoms is gone. Like most of my pain is gone.
So what would you say? Like, you know, and you said to me that you're part of like of an EDS group, Ehlers-Danlos Syndrome group in Israel.
Yeah.
So what would you say to them or other people who have joined Instability?
I would tell everyone to come here, like, only even to talk to you, like, to see what they're having, because I don't know if everyone has like what I had, but I know that for sure that you find a solution and you find a treatment for them, and you're so caring and thoughtful, like, it will be the main interest for you to the other person, like, to be in good health and like to find them a solution and to give them a really good, like a really better life and take away the pain. Like, you really care about it. I know you'll do everything for anyone you'll meet, and I'm really grateful for meeting you. I really am.
Yeah, you too. No, I mean, I you know, I was thinking about the interview today, because you understand, like, you know, you can't, sometimes with patients, I mean, you obviously get close to patients, but, and maybe could we have your mom and your sister just come over here?
Yeah, come. We also feel so blessed to meet you guys, like all of you. Thank you, Leah.
Okay. Hey, Mama. It's like our last time together. Like, it's been an amazing few months.
Yes.
We're just gonna miss you.
Yes.
We're gonna miss you too. Like, we're sad and like we're happy to go back home, but we're also sad like to leave you all guys and to be so far away.
I just hope I hope together we can do something to, you know, whether it's to help Ehlers-Danlos Syndrome Society in Israel or around the globe, like just to get the word out that it's a ligament problem for the most part and that there is a treatment for the ligament problem. And Mama, has she been nicer? Like, she's been less cranky, or has she been?
She's happy.
Okay, and that's what you wanted.
Yes, if she's happy, I'm happy.
When she said that she wants to go see a doctor in Florida in the United States, like, did you think she was a little cuckoo?
No. And no, I wasn't thinking that she's crazy. I was thinking that she knows what she wants, and we have to manage how to help her.
You try to talk to doctor in Israel too. Like, you talk to spine specialists, we
try to speak, to try to find
to many
someone,
specialists.
because it's not easy to leave your husband, the family, and go here. But we didn't find anything, and she really wanted.
Okay.
And we saw the videos and we saw everything. So I said, let's do this.
They trusted me.
Yeah.
They knew I wasn't complaining just for complaining. I was really suffering.
So
like,
we will do it, and we did it.
It's been great. It's been great knowing you. So I'm just going to give you a hug, and then this will be it.
Get too emotional.
Okay. Great having you. Great having you.
For everything.
Great having you. Great having you.
Thank you.
Okay. Thank you so much for making this video.
Oh.